identified as the Crisis Prevention Center, where both adult and juvenile crisis will be operating out of here. So KHDS has always run adult and juvenile crisis, though it's never really been under one roof. And so we're really excited about, as we're moving forward, we're going to have a true family systems delivery service for crisis, having both juvenile and adult. We've been going this past year, going out on all of our cases together when it's needed. So we've really integrated the two units, and it's been a huge success. We spent a lot of time with our local law enforcement agencies in the response to inpatient hospitalization. Mostly with the downsize of private hospitals, we've been using Winnebago, and if you're on the County Board of Human Services, you've been hearing about the Institute bill. So we've spent a lot of time the last couple of years with local law enforcement agencies. If someone does not need emergent medical care, though they require a mental health assessment, we're going to ask that you come here, and we can do our mental health assessments right here, right at the entranceway, so it's not intrusive to the rest of the business. This area we will furnish differently as we get closer to opening up. But oftentimes through juvenile crisis, because we do after hours for Child Protective Services, occasionally we will actually have custody of children for many, many hours. And so we're gonna set this room up. We're really looking for a trundle bed, day bed, because often we have kids that need to sleep until we can find and secure foster placement. So we wanna get a TV and toys. Again, something that's more comfortable and comforting for children that are in crisis before they transition to a foster home. So we're really excited about this space. So tomorrow, there'll be delivered workstations. At any one time, we could have 6 or 7 crisis workers working. So we'll, I guess, identify this as the bullpen, for lack of better words. And so tomorrow, BNL will be delivering workstations that will wrap these, and this is where crisis workers can come to do their notes, take phone calls, connect back in, upload any information they may need. But the idea is that community can come in. That first room will be identified as more of a family-style interview room. Somebody needs to come in, and of course we have the conference rooms. This will be just taking calls, dispatching calls, connecting with often emergency rooms, law enforcement, dispatch, schools call us, and then we deploy out. So this is the end now of the Crisis Prevention Center. This door will remain shut with a key fob, and now this starts our CBRF, the Care Center. So if you've been in the area before, this was all open office space. So 3 bathrooms were built for our residents, and we're going to keep a washer and dryer up here for resident use only. There's commercial grade washers and dryers in the basement for staff to use for linens, bedding, but this will be for our residents that can use for their personal clothing. So the current care center is in a historic building in Kenosha. It's at 510 60th Street, and it was the first hospital in Kenosha. And so it's hundreds of years old with a 100-year-old kitchen. So this is a game changer for staff, no doubt about this. We have 11, we have the potential to expand. So at this point, we're producing 33 meals a day. So to go from a small kitchen in a historic building to this commercial grade kitchen, I just can't imagine. So we have this community area living room. We will, like, in the next week or so, we'll hang a television pointed this way, hang another television pointed that way, so sound doesn't become problematic. But again, having an area where everybody can be together, but you don't have to be all together, of course. Depending on why you're here, you don't, perhaps you want to mingle and socialize, but perhaps you don't. Over here, we have 3 rooms. These are the only 2 single rooms in the facility. And so we would identify these 2 rooms to be used for people going through an opiate detox. There you go. Thanks. This would be a good example of a double room. You understand the square footage of a double room versus the single rooms we took a look at. What we found out about bed bugs is that wood is something that a bed bug will get into. So these are metal. The angle of the legs and the paint that is applied to this is alleged. The bug is unable to crawl up the surface. And so they came from a company out of Washington State, and they arrived today. Yeah. So we have mattresses already. The mattresses will of course come with our residents, so we'll have mattresses when we move everybody over. So again, we have more rooms. Again, these are all double rooms. We have one room identified for hearing impaired. So there is a fire alarm in there that's a strobe light and not just an alarm. So as a CBRF, as we're licensed for adults, no children are ever here. So we wanted to make sure that the door, there's a clear definition, a clear way that individuals at the care center aren't walking into the business side and the public over in the business side is not walking into the care center. So when a new resident comes in from adult crisis, we're going to identify to use the side door. Again, we want to maintain everybody's dignity and privacy specifically. So we're not going to use the two main entrance doors. We're going to use this side door here. This is where we have our commercial grade washers and dryers to do our linens, our towels, all of the necessities of running such a large CBRF. But we will also have two superheated. They look like almost the size of a large dog crate that have motors on the bottom. They zip up and you can put belongings in there. It will superheat treat. And the idea is that if you do come in with bugs or light, whatever may be in the bag will not survive the heat treatment of the bag. And then we'll immediately launder your clothing as well. So get cleaned up and have clean clothes as soon as you visit. This will be the pantry for our care center side. Again, at this point, we're doing, with 11 residents, we're doing 33 meals a day. If we increase that all the way up to 18 at some point, of course, the amount of food we go through is quite amazing. So we'll be able to have our refrigerator and freezer up into our kitchen. We'll have another refrigerator, another freezer, and then we will line the entirety of this room with a working table in the middle. Again, this space is triple on what we currently have. So the generosity really of the county and the city and all the hard work on all of the services committees that have been done, I mean, it's going to change people's lives, and it's absolutely going to change the way we do our jobs for the better.